Well, on to more breaking news tonight, this time out of the nation's capital. The Trump administration is reinstating $2 billion in federal funds for addiction and mental health programs nationwide. This reversal coming less than 24 hours after termination notices went out to thousands of programs nationwide, including in St. Louis. Our Sean Logging is in the newsroom reporting on how the original decision, Sean, to strip the funds from organizations is already having an impact.
Morgan, this reversal adds to the confusion of the past 24 hours as there's been no clear explanation for why this funding was cut in the first place. It's critical funding these organizations rely on. The email arriving late Tuesday night.
Around 9 p.m. last night, as I was sitting at home, I began to see emails pop up from SAMHSA,
bringing with it far-reaching impacts.
I was devastated. You know, I had to lay off 3 people this morning.
SAMHSA, Substance Abuse and Mental Health Services Administration, terminating 2,700 grants, totaling nearly $2 billion, according to reporting from CBS News.
It's really put a strain on our whole behavioral health, substance use safety net in our community.
One of those grants, $2.5 million for Annie Malone Children and Family Services. Keisha Lee says it's for the SAFER program for youth drug treatment and prevention.
It's very much so needed inside of the schools. We do prevention work with them just as young as 3rd grade. And they also do drug treatment in the evenings. They feed them dinner. They get free therapy. We've turned a lot of lives around.
At Prevent Ed, 4 grants cut about $2 million, covering supports for people in recovery to access treatment and peer services, school and community substance use prevention, mental health training, and overdose training and naloxone distribution.
We've really started to see some stabilization, some decrease in fatal overdose deaths, some easier access for people into treatment and recovery services. This will be disrupted now. At worst, we'll see deaths increase.
Jenny Armbruster says this isn't isolated to Prevent Ed. Wednesday morning, she spoke with partners supported by these grants like Assisted Recovery Centers of America.
There are legal implications to how we manage patients. We can't just stop their care because the funding goes away.
These organizations say this work will go on, but it's not without some difficult decisions on how to move forward.
And when you're in a crisis and the place you run to is in a crisis too, what are you going to do? It doesn't feel good.
And looking closer at those termination letters that they got from SAMHSA, it says that the federal grants no longer align with the administration's priorities. But those priorities listed in the letter include promoting innovative programs and interventions that address mental health, substance abuse, overdoses, and suicide work these programs were doing. Morgan.
All right, Sean, certainly a story that's developing by the minute. Thank you. And the future of the Annie Malone May Day Parade also uncertain tonight. CEO Keisha Lee tells First Alert 4 right now everything is up in the air. Last year, the historic parade was initially canceled due to budget issues, but later rescheduled. It was canceled again after the May 16th tornado. Lee says her board has a meeting next week to discuss things, and they'll go from there.